online art therapy, I think are very current for art therapy practice and research. So yeah, I'm just delighted to be here with you. I would like to start with this image. This is the image of my living room. You can actually see it in my background today as well, although the plants have changed a little bit temporarily. So this is a space with which my colleagues are fairly familiar. I work from home much of the time, and this is the space I'm sharing as my personal space, but it becomes very much a professional space as well. So in therapy context, blending of the multiple physical and non-physical places in case of online art therapy happens, and this creates a shared experience between the clients and therapists. It's quite a unique situation, and I would like to share with you some of my reflections on how this sharing of spaces might happen in online art therapy. And I will give as an example, particularly a recent project in the Western Isles of Scotland. So I really got interested in the subject of online art therapy quite a while ago, about 20 years ago, at the time when I was working in Aberdeen at the Royal Cornhill Hospital. It's a mental health hospital. And I met a patient there who benefited from online art therapy immensely. This patient suffered from recurring depression and was transported actually on a helicopter from Shetland quite regularly to Aberdeen to receive treatment. So, this patient seemed to benefit particularly from art therapy, which was then delivered within the hospital setting. But then as soon as they came back home to Shetland, the therapy stopped for them. So, this got me really thinking about whether we could deliver art therapy online to people like this patient who might not be able to access therapy face to face. And obviously times have changed in this 20 years, and there are art therapists now in Shetland. But situation still for rural Scotland primarily is quite complex, and art therapy services are not really delivered frequently in rural and more remote areas. So they mostly are centered in the central belt in Scotland, so around Edinburgh and Glasgow. Although obviously the example of Teapot Trust work is really amazing here, because you are obviously reaching out to other areas, which is fantastic. So I'd like to tell you about the pathway which I created to examine this notion of online art therapy in research terms. And to me, this meant exploring initially the literature on the subject, then trying to understand practitioners' perspective before moving on to researching more and learning more about what clients think about online art therapy. So these three areas are actually three distinctive research projects that I would like to tell you about today, but they are very much interconnected. And I'll mostly speak about the third one because it's the most practical example of what actually can happen in online art therapy, and yeah, just to discuss if it could be beneficial for people. So despite my long-term interest in this area, it was not really until 2020 when I first got a chance to research this subject properly, and I got to synthesize literature on the relationship between art therapy and digital technology in terms of both online delivery of therapy, but also in terms of using digital media in art therapy practice. So this time only coincidentally actually aligned with the COVID pandemic. And at this point, it was all, to me, this research was all about ambivalence. So I found in literature of the last 20 years that there were two generally opposing tendencies in the art therapy community in terms of art therapists' views on online practice. There seemed to have been an appreciation of the opportunities that digital technology brings to practice, but also this was combined with a little bit of resistance in art therapists. And this was purely because they were concerned about ethics and confidentiality and other aspects that technology inevitably brings to art therapy practice and that needs to be considered. So this work on reviewing literature has moved for me into conducting a survey among art therapists to find out really from their practice about their views and perspective. And in this work, the word transition was really important. I think it was all about transitioning, mostly due to the pandemic, but all about transitioning from face-to-face to online practice in the art therapy community, which actually happened with unprecedented speed in 2020. And this was often against own preference of therapists. So this was quite a complex time for therapists to work in. And so we surveyed art therapists practicing in the UK. We received nearly 100 responses. And in this survey, what was really interesting in the summer of 2020 was that we found that 90% of respondents had been actually working online at this time, of whom 87% have only been doing this since March 2020. So you can see it was a very fresh mode of working for art therapists at this time, and quite a rapid transition that they needed to adjust to. And interestingly, in a similar survey, which was conducted about 15 years earlier in the US, the researchers found that none of the art therapists actually worked online at this time. So we can see the change in times and the use of digital technology was quite rapid. So at this time, it became apparent that therapists actually needed really needed more guidance in terms of how to work in virtual spaces safely with clients, how to do it most meaningfully, and here are some words that art therapists from my survey used to describe their experience and their feelings towards working online. So you can see it's again a lot about ambivalence, a lot about transition, a lot about curiosity and opportunities that online practice might bring, but also some words that describe uncertainty and a little bit of potentially more challenging feelings connected with this. So in this research, there was one aspect still missing, quite important aspect, I think, actually absolutely vital, and this was client perspective. In the research so far, the therapist's perspective was shining through, but we knew very little about the client's perspective. So an opportunity to gain a little bit of insight into client experiences and what they feel, how they feel as online art therapy participants arose in Western Isles to me. So thanks to the support from NHS Western Isles and a large European project called Empower, we were able to develop a new online art therapy service for adult residents in Western Isles. So this was a pilot project, a small project, but it gave us quite a lot of insights about online practice. So I think context here is quite important. I mentioned Shetland to you earlier, and this project happened in the Western Isles. For those of you who are maybe not familiar with the geography of Scotland, this is where it is. So quite a remote and rural areas. I think there are currently only 2 art therapists practicing in Western Isles, but also they need to travel quite a lot to see their clients face to face. So the distances in Western Isles are really quite vast. And I know that they quite often spend an hour or 2 hours in a car. So online art therapy is really useful in places like this. So we advertised this project through community organizations and art groups and art organizations as well in the Western Isles. And the therapy in this project was offered as a block of 8 weekly sessions. I know, Zoe, you mentioned that 8 is really short-term therapy, might not necessarily be that effective as a longer one, but this is only the resource we had. So we needed to stick with this brief, solution, which we quite often need to do in both practice and research. And digital equipment and art materials were provided to participants. So this was very much appreciated. So the participants had a chance to try both traditional arts media working online, but also to try digital art making working on iPads. So that this was for their choice to make together with their therapist. We had 2 therapists working on the projects and 8 clients took part in therapy. The project was evaluated quite comprehensively for the small scale of the project, but we used many evaluation methods, qualitative, quantitative, and also art-based methods, including questionnaires, focus groups, interviews, and a specific method called audio image recordings. I'll come back to this method later on. So the aim was really for me as a researcher to understand which methods work also best, which give us more information, most information about client and therapist experiences, and which are acceptable by clients and therapists. I think in research it's really important that we use methods that do not impose, burden on participants and clients. This is mostly important that they benefit from therapy. So it's quite crucial how the research is designed, and this was a sort of an opportunity for me to test various methods as well. So in terms of experiences of our clients in the therapy, they generally found it an enjoyable experience. Both clients and therapists valued the flexibility and convenience of working online. And clients agreed to varying degrees that the experience of art therapy was helpful, worthwhile, interesting, but they also said it was challenging and surprising. And some of the participants commented with adjectives that were not on the list that they could choose from. They added their own, and they used words like relaxing, thought-provoking, enlightening, fulfilling, revealing of different perspectives, but also they said it was a safe and nurturing space. And clients who had previously had experience of psychological therapies, they appreciated the opportunity for nonverbal expression. And to some people, it felt less restrictive and relieving pressure of having to be precise when describing very complex feelings and problems. They also highlighted that art therapy offered a more personal and dialogue encouraging and person-centered approach than what they experienced by seeing a doctor or a psychiatrist. So it was very much appreciated by participants. And the three quite distinctive but interconnected themes have clearly emerged from how people described what art therapy was for them. And they have described this experience as a judgment-free zone, a safe space for self-exploration, a space which allowed freedom to experiment, to express, to feel, and to immerse themselves in the creative flow. So I think these are the features of art therapy that normally we expect to see in face-to-face situations. And I think this project has confirmed that they were also present in an online situation, which is quite obviously a positive outcome for us. There were also lots of other benefits for psychological well-being that participants and therapists have observed in this pilot. So the clients reported changes such as acceptance of emotions and things that cannot be controlled, better understanding of self, increased confidence, improved resilience, a newly gained perspective on aspects of life, and also improved relationships. This was quite a surprising outcome, quite unexpected. But two actually participants mentioned that because they shared the process of art therapy with their relatives, they found it much easier to communicate with them, and they found that the relatives were more understanding of their psychological needs and emotions. So this was really interesting. And a very unique method which we used in this project was a method called audio image recordings. This is a unique method for art therapy developed by an art therapist and researcher, Neil Springham. And this method is about recording a prompted discussion between a therapist and a client. So this is run by a therapist, not a researcher. And this is quite an intimate space where they two discuss the images that the client had created in therapy. So those are then recorded, edited a little bit, and available as videos of between 5 and 10 minutes usually, as a sort of testimony of what the therapy process was like for the persons involved. So this is not only a research method, this is also a method that provides a reflective space for both clients and therapists, and it provides a unique method of recording progress for both. What was really interesting in this project was that one client was so particularly touched by the video that they had created with their art therapist that they wanted to respond with another video as a response to the video that they had seen. For them, hearing themselves actually describing their experiences of depression in this particular case was so powerful, and they allowed them to take a step back and actually observe their own state from a little bit outside. I think that this particular person found this experience very, very therapeutic in itself. So we can see how research methods, if they are matched well to the particular people we try to gather information from and gain understanding from, they can actually be quite therapeutic as well. And this is what I'm striving to do in my research, to trying to adapt the methods so that they are as therapeutic as they can be. So in this pilot, all of the participants actually felt that more people would be interested in art therapy if this was available to them. Staff participants who are referring clients to therapy, they felt that there were not many other services in the Western Isles that would be able to meet the clients' needs as well as the therapy provided in this pilot. So I feel that the project, despite its small scale, demonstrated quite well that online art therapy was not only a feasible option, and this was an acceptable intervention for people, it was also an impactful one. And capable of instilling positive change in surprisingly short period of time, actually, as we're coming back to this only 8-week period, which actually the people who designed the intervention, including myself, I think we all were quite surprised, how this short time created a positive change. What was really important for me as well, and which has inspired my future thoughts about research, and the most needed research in the area, was that there was a clear evidence of the therapeutic process developing in online setting. So even if it was a time-limited situation, we could clearly see that both the triangular relationship, which is unique for art therapy, because it's a relationship between the therapist and the client, but also the artwork, so that was very much present in these online spaces, and it was possible to navigate those online spaces to still create, therapeutic and triangular relationships which were beneficial for clients. And actually, connecting in online spaces creates some subtle shifts within the triangular relationship between the client, the therapist, and the artwork. And while the therapist and the client are geographically separated, the client remains particularly connected and co-present with the art. And this is what the therapist felt happened in this project, and actually clients have confirmed. So we're feeling that because the client connection with the art is emphasized, the physical connection between the client and the therapist, the lack of physical connection might in fact affect art therapy less than verbal forms of psychotherapy when it is conducted online. So I think this is quite an important potential avenue for future investigation about what is specific about online art therapy in comparison to other psychotherapies and mostly verbal psychotherapies, and what we can actually utilize in terms of the connection with the image that's that makes this therapy work. So I'd like to share two quotes from therapists with you now, and they are very different quotes and describing a very different experience of working online, just so that you can hear from therapists that they might have very different experiences and visions of whether art therapy online works or not. And this is obviously not a solution that suits all clients and all situations. And I feel it's important to highlight that for some clients, for some situations, it's a wonderful thing to be doing, to connecting online. For others, it might not work. And the same for therapists. Some therapists are very comfortable and can work in this virtual space, while others potentially not that much so. So I think it's important to consider. So one therapist responding to the survey said the three-dimensional space is reduced to two-dimensional digital screen. It's the flattening of spatiality and the environment that they had experienced online, which you see describes the challenges for this therapist in connecting online with clients. While actually another therapist who took part in the pilot project in Western Isles, they said something like this: there is something about the kind of tightness and smallness of the space that sort of intensifies everything somehow. And it doesn't really feel like a flat screen. When the connection is good, it feels very three-dimensional, like a capsule. So this is obviously a very contradicting experience of an art therapist who actually felt that the therapeutic connection with the client was perhaps even intensified in these online spaces. So we can see different experiences. And to me, as a researcher, it's just important to see those, to be able to adapt on therapeutic approaches. So with obviously growing experience and confidence and research in online art therapy, and art therapists working more and more with digital technology, I feel that we are naturally moving beyond replicating face-to-face situations in this virtual worlds, but we are actually exploring the connecting virtually and online as a new territory that actually provides new opportunities for therapeutic process to develop. And I think it's an exciting place to be. And we need to be mindful of all the challenges that are linked with digital technologies and online connectivity. But I feel that we also should be trying to see into the future And just as Janus, as a Roman god of transitions and beginnings, he's often pictured with two faces. And this is an image by John Bellamy, a Scottish artist. And I feel that just as Janus, as this Roman god, we should be seeing into the past and taking from the online, from the art therapy tradition, using face-to-face practice and traditional materials, but also seeing into the future and exploring the realm of online work and the use of digital technologies. So there are just some references for you, which I'm sure we'll be able to share later with those of you who would like to follow up on this and have a look into recent research on this subject. And it's been really a privilege to capture a glimpse of this freshness of online experience for both therapists and the clients in those last couple of years. And I hope to be venturing more into the still uncharted territory of the impact that online work can produce for clients and the communities, actually. So thank you very much. I'd like to invite you as well to connect with me for an extended discussion if you would like to. Thank you.
Brilliant. Thank you so much, Ania. That was a really, really interesting presentation. It's particularly interesting as for us in the Teapot Trust as our art therapy went obviously online, similar to many other people when COVID hit, and we're continuing to work online with groups of children with chronic conditions and in other ways with individuals as well, and individual one-to-one sessions. So it's really helpful to see that the feedback from art therapists. There is a couple of questions for you, Ania, but again, we'll wait to speak to both you and Megan, our next presenter. So Megan is one of Teapot Trust's experienced art therapists and works with children and young people in Collingwood School in Newcastle, or in Morpeth actually, and in Great North Children's Hospital in Newcastle. And Megan works with children and young people in person and online as well. And Megan's going to talk today about a project with cystic fibrosis patients. So thanks very much and welcome, Megan.
Thank you, Kat. Hello, everyone. So I have a presentation. I think it's just being put up here. Yeah. So I'm just going to talk a little bit about a project that I've done, online groups for young people with cystic fibrosis. And this was conducted over the summer holidays and a bit after school time. So that did affect it because obviously we're working in their homes. So sometimes they were away on holiday and things like that. So that's an adjustment we had to make. Yeah, so should we have the next slide, please? So I have pictures in this and they were all shared with consent from the young people. So I'll just give you a bit of information about the group. They were offered 8 sessions, which were weekly at 4:30 on Tuesday evenings. So it was sort of an accessible time for them before, after school, once they got back into school time. Quite a few of them had already participated in a previous group. So some of them had been to up to 16 sessions by the time they finished. There were about 6 regular participants who came to every session. They were aged between 7 and 12 and a mix of boys and girls. The average age was about 8. They were all mainly around 8, 9. And they were all under the care of the Great North Children's Hospital in Newcastle. And so the reason that it was offered as an online art therapy was that current guidelines for cystic fibrosis mean that children with this condition can't meet in person. So for infection control reasons, they aren't going to be able to physically be in the same space as another child with cystic fibrosis. And that means that often they've not met another child with cystic fibrosis, and this is quite unique compared to other conditions where they might see other children in waiting rooms or in treatment facilities, and they might see older children, younger children as well. But also that the Great North Children's Hospital covers a very large area. So it goes right up to the Scottish borders. Some of them were over in Cumbria, around Carlisle, and a few were down in North Yorkshire. So to come to Newcastle, they often travelled for up to 2 hours anyway for treatment. So to get them to come weekly to a session would have been quite difficult as well. And here I've got a image that one of the young people did, which was about seeing other children with cystic fibrosis, and she's put a giant tree between her and the other child to sort of represent how they don't get to connect with each other. They don't see each other past this giant tree. Okay, so have the next slide. Right, so I'll just quickly go through some adjustments that I made personally for online working that I found worked for me. So I've done quite a few online sessions since the start of 2020. So I found that I had to be more active, more directive, almost to compensate for that not being in the room, and also to make sure that all the children had a chance to participate, because I think in a physical session, you maybe get more children who would talk openly, might talk to each other, they might notice each other's artwork as well, and you don't get that with the online, sessions. So that is something that's missing, and that meant that I had to be a little bit more directive, a bit more encouraging. So setting up opportunities for everyone to have a chance to show their artwork, to have a chance to talk. Also, to be a bit more, I had to be quite savvy with the Zoom technology, because I think compared to adults as well, lots of these young people were connecting to the sessions on their parents' technology. So they might be on a computer or an iPad that belongs to a parent, and they aren't really familiar with it. So there was a lot of adjustments made for that as well. So there might have been things that we could have done online with using iPads to draw with and creating more interactive sessions, but some of those children couldn't engage with that just because they weren't as comfortable with that technology. Yeah, so part of the group was that they made goals, and their goals were to spend time with other kids with CF and to have fun and feel better about ourselves. So with that in mind, I would create a themed activity that we would start with. So the structure of the session would be a warm up and a greeting, and then a themed activity, and then some time to make their own artwork, and then an ending, and we'd have reviews in between. So what I mean by the ending, so soft ending as well, that was another adjustment for art therapy online, is that it's quite abrupt an ending. When you're online, you click leave and then you leave, and that's a big difference from in person, where there's that time when you're clearing up, they're putting their coats on, they're leaving the room, and it's all a bit more, it's an easier transition. And also to bear in mind that they're going back directly into their house, so they're turning off their technology and leaving the session, and then just going straight back into their family life. And we've created a space where they've opened up, they've talked about some difficult thoughts and feelings, and there needs to be a transitional space there where they can readjust back into their life. So this was one of the soft endings that we did. So this is some monsters, and each child had a chance to describe a monster, and we all drew it and saw if we could draw the same monster. So they would say something like, my monster has feathers and a beak and tentacles and 2 eyes, and everyone would try and draw the same thing. And it also helped a lot with group communications. That was something else that I was very interested in with this. So trying to encourage them to communicate with each other. Can we have the next slide, please? So one thing that I noted early in sessions was the group were only communicating via or with me. And in response to the group goals, I wanted to create opportunities for interaction as if they were in the room together. So that was one of the themes, that we wanted to create a sense that they could connect, they could talk to each other, and that they would have that feeling of being in the room together. So one group member reflected that it was amazing to spend time with other young people with cystic fibrosis. And in response to this, we started to create a story. So what I'm going to do is just quickly show you their story that they made. So their story was called The Girl, the Bear, and the Unicorn. And this is the girl. And each group member would draw as they made their story together. And we're really looking at collaborative working. So in order to negotiate this story, there had to be a lot of collaboration, a lot of discussion over what was going to happen, what things were going to look like. And afterwards, once they'd finished their story, one of the things was that they all felt like they were together. They could be together within this story. So that blending of a physical and a non-physical space was created through this story making, this art making, where in this world, this imagined world, they could all be together and interact. So I'll just start the story and you can have a listen, and we'll look at the pictures as well. So the girl wakes up in her pajamas with a blanket wrapped around her. She's a little bit scared and confused. Have the next slide, please. Okay. She looks around and sees that she's in a beautiful meadow. Suddenly, a unicorn appears and tells her that she's special and shows her around. So we can have that's the meadow. That was one of the young people's images of a meadow. And then we've got an image of the unicorn as well. There are other children in the meadow and they all become friends. Okay, have the next slide, please. The unicorn teaches the group to walk across rainbows to travel around. It shows them that they have invisible wings that will help them. Suddenly, a huge, scary bear charges across the meadow. They're very frightened and they run onto a rainbow to get away. We've got our bear there that was made by one of our young people, and a painting of what it looks like when you travel across a rainbow as well. Have the next slide, please. The bear tries to follow, but his paws fall through the rainbow and he falls and cries. I'm not a scary bear. He looks so sad the group feel really sorry for him and go back. He says he doesn't mean to scare them, and the group teach him about his invisible wings. When he finds his wings, he's so happy they become visible and they're huge and beautiful. So you can see the bear with his multicolored feathery wings as well. Okay, the next slide, please. The children have to leave the meadow. They're sad as they like to play and chat there, but they know that they have their wings and can visit the meadow to feel together whenever they want. This is a group portrait that one of our participants made, and each colour and shape represents one of the group members, and she's written, "We are all together," and she's got one that says CF, one, she's turned into a dog and an elephant, and she used this to create this image of a group portrait, really, where they were all joined and connected. And from then on, really, so that was the end of their story. And from then on, we had sessions that took place in that meadow space. So we would start the session by just imagining the meadow and thinking about what colours they could see and who else was there. So we would name the other group members. And it was really to encourage that feeling of we are together. We're not physically together, but we're entering into this shared imaginary space. And then they might create artworks in that space. So as if we're sitting in a meadow together and we're making artworks together. And that really sort of replaced something that felt like it was missing online. And as the group were so keen to create these connections with each other, actually having that imagined space that everyone could share in helped to facilitate that, I think. Okay, yeah. Next slide, please. Okay. So in the final session, the young people made a flower from the meadow to take away with them. They reflected on their story and shared that they saw themes of unexpectedness, with one girl stating, "No one expects to be sick when they're a kid, and in our story, unexpected things happen as well." The other theme was connection, so having a space together. And they identified that the bear showed that sometimes things seem scarier than they really are, and that it's really sad to be left behind. And that was one of the main things that actually the young people brought up, was that feeling of being left behind, of not being able to do things that other people could do, or plans for the future as well, because they were all reaching an age around 10 where the medical staff are quite clear with them about what their outlook will be with their condition, what they can expect in the future. This is when they start to have those quite difficult conversations, and they identified that maybe that was something that the bear felt because he was left behind and he couldn't go on the rainbow with the rest of them. And the final one was finding out that you have wings all along, and that sometimes they're invisible, so you don't know how strong or special you are. And this theme carried on in quite a few of the artworks that they made. So they would make self-portraits, and sometimes they'd have wings and sometimes they wouldn't. And they would talk about how they didn't know that they had these wings, and perhaps they could do more than they thought they could. And I think as well, some of the feedback was that seeing what other children were doing. So we had group members who did gymnastics, and there was a boy who did rock climbing, and a girl who was really heavily involved in Highland dancing. And some of the other group members seeing what they can do made them think, well, maybe I can do more things as well. And those sorts of things, it's different. I think the feedback was that it was different actually seeing another young person and them saying what their experience was and what they can do, compared to medical staff or their parents saying that they could do it. They're actually meeting someone who has the same condition as them and seeing what they can do as well. Yeah, so I wondered if we'd like to go back and look at some of the images in more depth, because I know I went through them quite quickly, if that's possible. So, yeah. So we had a range of materials sent out to them. So each child got a art pack. So you can see that there's quite a lot of different materials used. So we have oil pastels here, and this was created by one of the girls. And this was her character. So she wanted to be the main character in the story. And then the other children drew their own characters, but for the sake of the narrative, she was the main character. Go on to the next one. Yeah, so this one was the image of the meadow was created with with watercolors and pencil. What you can almost see is that this young person, she drew around her hand, so you can see it almost looks like a mitten. So then the idea of having that meadow that she could hold, it was a space that she was holding, that she had in her hand, and adding all the colors that she could see. So actually in that, the meadow that we went back to was quite useful for entering into that therapeutic space, where we had that time where we'd do some breathing exercises and we would see what the meadow was like this week, whether it was raining, whether there were new colours, what was going on in the meadow. And that was a nice entrance into the sessions as well. And then we've got the unicorn. This one was made using pens as well. So the unicorns really became this idea of something to guide you as well through the sessions. Have the next one. So this one was created using paint as well, and lots of sort of splashes of colour, and this idea of transitioning through each other. So yeah, so moving around together, and then there's the bear as well. So the way we ended up with the story was from one of my themes. So I prompted them not to create a story, but to imagine a space where we could all be together. And really the story developed quite naturally from there. So they would each draw something, and there would be a lot of participation in terms of talking. So this really moved us away from the young people talking to me and then me replying back to the group. So sometimes someone would say, can I share what I want to do? And they'd be directed to me. So instead they would be talking to each other. So it would be, while we're in the meadow, what if this happened? What if that happened? I've drawn this, what do you think of it? And it shifted from it being a focus on me and then the participants to them really feeling like a group, and they were taking this together and moving the story forwards without any prompting from me. Yeah. Okay. We're having the next one. Yeah. So we've got watercolors here and the bear with his wings as well. And I think this image of rainbows as well is something that we see a lot in the hospital, and there's lots of images of rainbows around, the idea of transitioning and something that's beautiful that comes out of rain. So that was a theme that they used a lot in this. Okay. And the feedback from the group was that, again, it was mainly about, it was amazing meeting other young people who had similar conditions. One young man said, I feel better about myself than I used to because I felt like I was all alone. And another boy in the group said, it was really great to meet other people who had the same thing as me, and we could talk about what we were doing together. Yeah, so actually I've run a little bit faster than I thought I was going to. So if we go on, so the again, because it was only that 8 sessions, creating that flower they could take away with them was a bit like creating, you know, a sort of transitional object that they could take away, because it was quite a short intervention, and we would hope to maybe do a bit more in the future. And several of them have now gone on to one-to-one art therapy as well. So there is that option for these young people as well. Okay. So thank you, everyone. Sorry, I went a little bit fast there. So if anyone wants to ask any questions or see anything else, that's...
Thank you, Megan. That is
just
amazing. I'm really glad we've got time for questions, actually. So I know Ania is still in the room as well, so we'll wait just to see Ania pop up. There she is. Thank you both very much, because that is really insightful. You know, seeing the research that you have, and then seeing an example of what can come out of an online group. There was a couple of questions around the assessment for art therapy. So around whether, you know, as you said, Ania, it's not something that everybody is suited to, and just thinking about what do you need to think about, what sort of thing would you be looking for when you're doing an assessment of whether, and how easy is that to do when it's group, and also that you're doing that often online as well. So I don't know, Ania, if you've got any thoughts.
Yeah, I feel that the assessment definitely requires, you know, quite a lot of attention anyway, whether it's in face-to-face or online situation, but definitely online situations create additional concerns, just things that both therapists and clients need to be aware of. I think what really I found in the survey from art therapists was that their primary concern was the safety of clients. Obviously, in case of young clients that you work with, this is even more so because their safety depends not only on their relationship with the therapist, but also on how parents or guardians are involved in their therapy process. So I think in terms of creating safe spaces, therapists often found, at least from what they had shared with me, was that they appreciated additional time and opportunities for to meet their clients prior to starting the sessions, almost like scheduling dedicated time online, really just dedicated to making sure that we are all okay in this space, that the space is actually safe. There's obviously, at least two physical spaces if it's one-to-one therapy, or many more spaces if it's a group therapy. So it's very important to tune this all in, and I guess this additional time required for preparation was something that I came across from therapists' experience, and something that they found they actually needed, and they needed this out with of the session time. So perhaps one tip like this.
Yeah,
Brilliant.
I think I found that similar as well. So I for each client who came and joined the group, we had a sort of online session beforehand, and it was usually with a parent, where I would talk to them about what kind of space they need, how to look after their artwork, how to keep it safe afterwards, and yeah, really make sure that that's in place before they joined the group. Also, another thing I think is that there were young people who were referred and that this team thought would really benefit from art therapy, but you're relying on their parents and on them either having a good internet connection or good technology, or also if they've got quite a chaotic home life, that might mean that they would really benefit from some art therapy support, but it also means that that's going to be quite difficult for them to keep a schedule and to get online at the right time, and often those were young people who didn't end up engaging.
Great, thank you very much. There's also a question around sorry, I'll just go to it. Thinking about the soft endings you mentioned, Megan, is there a way for parents, carers and families involved in making that transition easier, and sort of what type of conversation you're having with parents in that assessment about what that might look and feel like for children?
Yeah, I think making it clear that they are going to be going straight back into their life. So sometimes I would suggest, maybe if they like a warm drink or something, they can just stay where they are. Maybe their parent could bring them a snack or something, and just have a little bit of downtime after the session to replicate that idea, because often in person, again, you have that leaving, you then might travel home, you've got a bit of processing time, whereas online it is that very abrupt thing. So I would often advise parents maybe that they might just need a little bit of quiet time, or that could be a nice time for them to have a bit of one-to-one with their child. If they if they have siblings, maybe that's a nice time for just to have a bit of one-to-one time with a parent.
So there's just a couple of questions coming through on the chat now. I think, Megan, somebody asked about the story and how you introduced that, but I think you covered that in the presentation. So unless you had anything else to add to that. There's a question around how it works with older children and young people. So I know that you have worked with teens in
Yeah.
similar groups, but yeah, I wondered if you could touch on that a little bit about how that works.
Yeah, I think with older children, so I run a group for teenagers. There's a lot more communication directly with them. So usually they have their own email address, and for them, what's been a positive feedback that I've been getting is that they're in control. So it's something that's just theirs, and they really like that opportunity to use the technology to actually have that control over what they share and what they show. So often the cameras might be off, or they use the chat function to talk to each other, and that's something that seems to come out more in the older groups, that they value that idea of they're in control of the space, and actually they're more in control than they are in person, because they can even choose to just describe their artwork, or to what to share and what not to share, and when to speak. Yeah.
Right.
Yeah. Yes, I can't really relate, to the question in terms of differences for teens and children, but I can share just briefly, experience of this from working with adults. And what we found in the small pilot in Western Isles was that actually the adults involved, they really, the feeling of being in control in online situation was something that they really highlighted too, and they felt more empowered to really take care of their own health and well-being through this. And I think this was quite evident when some of the participants actually decided to continue with creative activities beyond the sessions on their own. So this was something which they would never actually consider before. So I think this actually online situation can, to some people, it can give this this feeling of additional control, which might have long-term benefits for people, I guess.
Mm-hmm. Right, thank you. And there's one more question. Just wondering about the managing the discussion online, and how it can be difficult not to interrupt and chat over the top and have lots of, and just whether you had a system for that, Megan, in the group that you did, or the groups that you do.
Yeah, I think really for me it's about making sure that everyone has a chance. So at the beginning of the sessions, we make a group agreement, and one of the things that is in there is that we try not to speak over each other. Sometimes it's hard because there's a delay in the audio, so sometimes someone's speaking and you don't realize they've spoken yet. But I think that's where, compared to in person, I'm a bit more directive. So I might say, okay, it's going to be your turn to speak next, and now it's going to be, so if someone's wanting to do something, right, okay, you'll go after so and so, but at the minute we're listening to this person, or we're looking at their artwork. So it is a bit more about managing that, which I think is different from how you would work in person. Otherwise it can end up quite muddy with everyone talking over the top and no one really gets their chance. Yeah, so that is being a little bit more directive than I would normally be.
Great, thank you. Ania, do you have anything you wanted to add to that?
Yeah, I guess just only maybe to echo what you were saying, Megan, about the directiveness, and perhaps this additional need for therapists to really think things through, perhaps even more so than in face-to-face therapy. Just imagining, those situations that might appear. Perhaps the more directiveness and building rules as you would normally have for group work anyway, but this is especially important in online space. I also found from what therapists shared with me. So yes, so I think this is something that perhaps providers and organizations like yourself as well, I guess, need to be aware of in terms of building more time for therapists to really properly prepare for such sessions to really ensure they are safe. But also what I maybe wanted to share very briefly as well was experience of one of the therapists working on the pilot study. And she had shared that actually the little disturbances that had been happening in the client's home, like dog barking or partner suddenly coming into the room, things that you don't really want to have in a therapy space. But she shared in this project that initially these were things that obviously she considered as obstructing the therapy process, but she learned pretty quickly to really turn them into the benefit, and actually to potentially use them as those little moments in which rapport could be built with the client, and sometimes the glimpses into personal life. I think this is really so challenging as well in online therapy, that you get those glimpses of personal life which you normally wouldn't. You only would if the clients chooses to share them with you, while in online spaces they just happen. And I think it's really important that the therapists need to be so sensitive to those, and there's a potential to turn them into therapeutic moments, but there is also they might also be challenging and disturbing for therapy process. So I just feel that delivering therapy online is really such a skillful thing to do from art therapists, and just wanted to highlight this, that I'm just totally impressed by the work you're doing, Megan, and other therapists working online. I think it really depends a lot of skill and sensitivity.
Thank you. Just a couple of last questions. I mean, sort of linked to that is around, what is there a need to expand what the art therapy courses are they covered? Is working online part of what your part of your training basically, and is that something that needs to change? I'm just wondering if either of you know or have thoughts on that.
It wasn't covered when I was studying. I graduated in 2019, so quite recently, but before the pandemic, so maybe things have changed now. But I think it would be really valuable, because in a way just building confidence for jumping into this, and that it is okay, and it usually works out quite well. And I think just because it's something that we've not been trained for at all, it can be quite frightening to do that.
Yes, I think really from the survey, in 2020. So it's been a while since then. It would be really helpful to to find out what art therapists feel now after having had a chance to practice online for a couple of years. Their experiences from 2020 were very fresh. But I really feel from what they had shared that they were really brilliant in so rapidly adjusting their practice without much guidance. And at this time, I feel that there was a common feeling that more guidance would be really needed. It was not maybe something built into art therapy programs, but I think it more increasingly is. Well, I at least know that that in Teapot University there will be a module on online art therapy, which I was invited to join as a tutor. So there are those initiatives, I think, going on, and more awareness of training. But yes, but I was really quite inspired how art therapists adapted, their own practice just based on I guess some ad hoc, solutions at this time, like really speaking with peer therapists, with their supervisors. I think supervision was something that they had highlighted was really important at this time. But right now, after several years of online practice, I think we can count more and more on more formal guidance and formal training that's been slowly, I think, developed.
Brilliant. Like, there's just a couple of people in the chat have said that they have just come to the end of their art therapy masters, and all of their personal therapy was online. And I suppose that's something else that has changed quite a lot, is the fact that over COVID, obviously, the learning and education was online as well. So it was a different experience. And then Vicky has mentioned that she's training at Brunel. We do have a focus on art therapy in the post-human world. It's very important in this changing world. So we've still got a bit of time. So if you don't mind, I'm going to ask another question that's come in around just the use of art materials with online group versus in-person group, and how you encourage that, and the sort of differences you find when using art materials when you're with someone versus online, and whether there's anything, helpful there to think about.
I think one of the things that I've noticed is that they're less inclined to make a mess because you're in your own home, and there's not that feeling of freedom. It does seem a little bit more confined. It tends to be the dry materials, pens, pencils, paint, but in quite a controlled way. And I think that just comes from being at home, and you're sitting at a kitchen table or at your mum's desk or something, and whether you feel like you can just let go and create a mess and do things. So often it is a bit more controlled, a bit more confined to the page. Also, not being able to see the artwork often as it's being made. So I usually ask to see things every now and then so I just get glimpses as things are made, because you do miss the action. You can see if someone's moving a lot, if someone's being very controlled, but you don't get that actual eyes on the artwork as it's being made until the point where they hold it up and show you.
Yes, I think you've touched on such an important thing, Megan. Something that I would really love to find a solution to, or I don't know, at least research some solutions. I was actually considering an option of installing additional cameras, for therapists to see. This is obviously very tedious and quite disturbing personal space for participants and clients. But I think the difference of online art therapy, of not seeing the artwork being created, or not at least as frequently as something that really changes the dynamic for the therapist and the client, and something very specific that therapists need to be mindful of. However, it also comes back to this being in control, and I think this is quite an important aspect as well, that it gives this opportunity for the client to actually be in control of this moment that they actually want to share, in terms of where the artwork is at this particular point. So I feel, this has lots of challenges. This requires a very different approach, I think, from a therapist. Potentially, it has some advantages in giving the client more control on how they want their therapy to develop. But it's a very very complex subject. Also, in the pilot that I conducted, we were really fortunate to be able to have the resources to buy art materials, which were sent as art packs to our clients who participated in the pilot. So obviously this is something to be mindful of, that if a therapy happens in a personal space, that's just not an obvious thing that people would have access to art materials, and this might obviously increase costs, either for them or for therapists or organization who provides therapy.
Great, thank you. And I just wanted to pick up on something you mentioned as well about, I think it was around the review that you did, Ania, around the use of other technology within art therapy online. So, for example, I know Megan uses whiteboards, so it's something that everybody is contributing to. And I think your research touched on that, and that possibly we don't know what's coming yet, I suppose, either, in terms of other things. I wondered if you could comment on that.
Yes, sure. There's there's some evidence in research of art therapists trying to work with software developers to develop, even software which would be more suitable to art therapy use than things which had been developed for. I don't know, for digital graphics and things like this, which tend to be used currently because there's nothing better, there's nothing more suitable for art therapy practice. And also, there have been attempts in the US from quite a while ago, from about 20 years ago, actually, or probably even before then, when a specific software was tried in a group setting. So there has been thinking about this for a while, but here we are 20-something years after those initial, documented evidence of this activity, and we still don't have software specific to art therapy. And I think this is something which really should move on, and also give, also because there are other new technologies that come into art therapy world, and this is virtual reality. This is the use of generative artificial intelligence as well. So there are really new technologies that I think we should be aware of in addition to working online. So they can obviously go in tandem and being utilized while working online, but they can also be utilized in a physical space. So so I think that there is lots going on and lots of changes ahead. And I think we should all brace for it and just stay perhaps as informed as we can, to make sure that those changes are positive for practice rather than, disturbing the practice that's happening.
Brilliant. Thank you. So we've just finished a couple of minutes early, but I just want to say thank you so much for sharing that. And you both happy if anyone would like to get in touch to, either ask about what's happening with the groups or with anything that you touched on in your research, that would be amazing. We will send on links, and we'll send on the presentations and the recording of this so people have it to reflect back on, because I certainly think there was a lot in there, so I'm sure people will maybe want to re-watch it again. I just wanted to highlight a couple of things. There's a session this afternoon which Dr. Patricia Watt is running, which is also around an online project, Megan, that you are also involved in, which is around working with GIA patients, and it focuses also around that supporting families and children at the same time. So again, that was digital work. So if people are particularly interested, that session this afternoon might also be of relevance. And it was just when you touched on VR, we, as part of the Teapot Trust Garden, moving up to Glasgow Children's Hospital, we've created a virtual reality version of the garden that was down to be used in the hospital, and is working with one of our art therapists there. Who has particular interest and experience with VR work. So if anybody's particularly interested in seeing what's happened, that's not part of the conference, but again, happy for people to get in touch with me if they would like more information. So we're just going to finish for lunch. We are due back at 1:45. So I'd just like to finish this half of the day by saying thanks again to all the speakers this morning. It's been a fantastic session. So thanks again.
Thank you.